hospitals of the country, and we have more male than female, and you can see the age group. The onset of the disease is known 24 years, but in this category you will find that 18 to 45 we have the maximum patient, and very recently we started getting patients below 11 years age. The youngest patient we had, he was only 2 years old with pancreatitis. And one interesting finding will come there, because we are dealing with minerals. These all the patients who were below 11 and had been diagnosed with pancreatitis, their mother were moderate to severely anemic during their pregnancies. And this is the result at a glance of 990 cases who have been enrolled during this year. We have 17 deaths, and we have included even those cases who have taken medicine only for 5 days or grade 2 plus swelling in the body. We have taken the patients who had hyperbilirubinemia more than 20 in the beginning, because we didn't know. So, but whoever came, we have recorded it, and we are 7 cases are those who took treatment. They were better for some time, but either they relapsed or remission. But more than 50% cases have completed 1 year long treatment, and they are having symptom-free disease. And 339 patients are on treatment. Initially, when we started, there was a lot of apprehension about Ayurvedic medicine. There was not much name, and since it is a metallic science, people took the medicine but never started. It was that time when there was an OPD basis, so they were not able to take it. So this category is that. And we have 5 patients lost to follow-up, and 133 patients have incomplete treatment. And if we see the impact, so 476 patients have completed 1 year treatment after going through diagnosis and modern medicine. So here we have taken 1 year before Ayurvedic treatment, what was there, the history of weight loss, weight gain, hospitalization, emergency attack was there. So you can see that there was a significant change in weight loss, weight gain, and number of attacks which has come from 1763 to 104, and similarly emergency hospitalization has reduced to 95% after the start of Ayurvedic treatment. And these are the sustainable effects, that out of 476 patients, we have 6 deaths which we have reported, and 5 cases are relapsing who have dropped out. But this shows that Ayurvedic treatment which is given, it not only arises the progression, but it has a sustainable effect. Our first patient has completed 23 years. Now 2 patients have completed, or 5 patients have completed 20 years. So this data is soaring, and we are seeing consistency. So nearly 98% patients are doing well permanently after Ayurvedic treatment, and we have presented this case, these results last year in Hawaii, in USA, in the 50th Joint Annual Meet of American Pancreatic Association and Japan Pancreatic Society. Besides, we are taking research and development activity to make it in a mainstream medicine. The journey is long, but not impossible. And the first and foremost is reproducibility, process sterilization and characterization. This thing has been taken with the help of Uttarakhand government, who initially funded us in 2014, and our partner was Indian Institute of Technology, Science and Technology, Indian Institute of Science, Bangalore, and who has done the sequential analysis of that. You can see on the top, this red and blue is the first processing, and after complete processing, you can see this batch 1, similarly batch 2, and batch 3. And based on that, we can say that this medicine, it is a combination of these 6 minerals in different forms, and what is their what is the further structure, that has to be studied, but there is no free metal in the finished product, and this has been subjected for patenting. So this is the journey from metals, copper, mercury, sulfur, into a form of mineral complex. As you can see, red and blue, red and blue, and red and blue. and it has converted into that. So this is the nomenclature of this medicine, and these three batches have been done because of the WHO guidelines essential for reproducibility, and this is our benchmark. And this medicine has undergone safety studies in a accredited, internationally accredited and national accredited agency CRO in Mysore, and they have taken acute study, subacute study, chronic study, which was done for 180 days, and then 30 days no treatment was given, and in all the studies the product has been found absolutely safe up to 10 times of the given doses in human being. To bring more science, to add more science to our clinical efficacy, those two studies has been carried in rats by producing pancreatitis by giving L-arginine as a toxin, and in that study, this is the dose schedule, we found that this medicine, which was given in the practice and giving result, it works on a particular dose. If the doses are less than 3 mg, it doesn't work, and if it is 6 mg per kg body weight, it starts giving again deterioration. So with this study, it helped us to understand the dose schedule of that. The study was repeated again, and this time it was found that 3 and 4 mg per kg body weight, it works very well. So this study helps us to understand that Amar, which is the name of the medicine, is able to bring pancreatitis protective properties in animal studies. So this all substantiate our safety studies, as there is no free metal in this, and there is a experimental study to show histopathologically pancreatitis protective properties. So we are taking further step. We are going to conduct a controlled clinical trial in Bikaner. The scientific advisory committee has been set up under Dr. V.M. Katoch, who is the former DG ICMR, and his team, and they have done it, and it is under ethical clearance. Due to COVID, it has taken late, otherwise it could have started long back. And there are few publications and presentations which has been carried on our efficacy, clinical efficacy on the subject, and these are the references which we have used in making this presentation. With these words, I thank you, all of you, for being with us today, and I will call I will introduce one by one our patients to this, and in that category, I have first one is Mr. Kapil Singhal is with us. Can I see you, Mr. Kapil Singhal? Hi, how are you?
Yeah, hello.
Hi.
Hello. Good. Very good, sir.
So good to see you after a long time. So this is a brief introduction of Kapil Singhal. He lives in Gurgaon, and he will speak about himself. He was diagnosed in 2009 October, and his diagnostic hospital was Gangaram Hospital in New Delhi, and PSRI Pashupati Singhania College, and he had 10 attacks before coming to Ayurvedic treatment. So now hand over to Mr. Kapil Singhal to give his brief introduction and narrate his stories. And we have a very senior surgeon with us, Dr. Sushil Tandon. He will be interacting with you as
Hello,
a
sir.
senior panelist. Okay.
Hello, sir. So yeah, as Vaidya told, myself Kapil Singhal, and I am basically from Agra. Currently living in Gurgaon. I am a software developer by profession. So I was diagnosed in 2005 actually, and at that time I was hospitalized for around 10 days. So, but after that, for 3 years, there I didn't have any pain, nothing. So, but after 3 years, I was having attack on a very regular basis, around 2 to 3 months, at a frequency of 2 to 3 months. So, I used to go to hospital, and they used to give me some injections, and they hospitalized. The doctor used to hospitalize me for 3 to 4 days, depending on the severity of the pain. So this was my stay. In that time, I visited Hyderabad in Dr. and referred to Dr. Nageshwar Reddy as well. I took treatment from Gurgaon from Dr. Andeep Sood. I went to PSRI Delhi under Dr. R.K. Tandon. So I tried each and every doctor that I have heard of, but I was having the attack at a frequency of every 2 to 3 months. So in 2015, I came to know about Padaf. So I visited Padaf in 2015 under the guidance of Vaidji. So I took a treatment of 1 year, and after 1 year, my medicines. I'm not taking any medicines. So these for the last 3.5 years. So I am pain. I am having pain-free life and without any medications.
Thank you, Kapil Singhal ji. Dr. Tandon ji, would you have any question with him?
One definite question. You were fine from you were diagnosed in 2005. So there we
Yes, sir.
defined.
Sorry, sir.
Yes, you was diagnosed in 2005.
Yes, sir.
Hello.
Yes,
For
sir. Yes,
how
sir.
many years? How many years you were absolutely fine after 2005?
So, sir, for 3 years, I was absolutely fine. I went to Kota for JE preparation. So in Kota, I didn't have any pain for 3 years. But after 3 years, so I was having pain on a regular basis.
Any other question you have, Doctor sir?
Some connecting problem.
Hello.
I just wanted to ask him that he was fine for 3 years. Then what was the reason for the precipitation? Did he change his eating habits or alcohol or whatever it was?
No, sir.
For
No
3 years he
alcohol.
was fine, and then nothing doing.
No, sir. So the reason was
You
unknown.
are vegetarian or
Like
non-vegetarian?
I am vegetarian, sir.
Are you vegetarian or
So
non-vegetarian? Pure vegetarian.
vegetarian, sir.
So you are under
Yes, sir.
treatment
At
of
that time,
you are under treatment of veggie. So, from 2015, you are under treatment of respected veggie.
yes, sir.
Hello.
So I took medicine for 1 year.
For last 4
Yeah,
years.
can you hear me, sir?
For last 4 years. Yes, I can hear you. For last 4 years, you are under treatment of veggie.
So actually, the treatment
Hello.
was of 1 year. So yeah, can you hear me, sir?
Yes. For last one, you are absolutely
So the
fine.
treatment was of the treatment was yeah. So the treatment was for 1 year. So Veggie gave us medicine for 1 year, and after that, my all the medicines were stopped completely. So on the first day when we visited Padab, so all the allopathic medicines were stopped at that time only. So Veggie gave us Ayurvedic medicines for 1 year, and after 1 year, all my medicines were stopped. So for the last 3.5 years,
My
not taking any kind I am not taking any kind of Ayurvedic or allopathy or homeopathy medicine. No medicines for the last 3.5 years.
my personal advice is, as you must be knowing very well about the pancreatitis, is not a good disease at all. So
Yes, sir.
don't leave veggie. Don't leave veggie.
No.
Sir, we are in constant touch. We keep on repeating MRCP every year. So we welcome now another panelist today, Dr. Girish Chand Singhal ji, who is again, I think, colleague of Dr. Sushil Tandon ji. He was also class fellow of my brother-in-law. So these two great doctors had been my teachers, though I never paid any fee to them. But they have been supporting me, encouraging me in my endeavors. And Dr. Singhal, who is in practicing in Delhi. He's a senior cardiologist there, and he was my co-PI in the project which was given to me by the government of India, acute pro-myelocytic leukemia. So Dr. Singhal साहब आपका बहुत बहुत स्वागत है. और recently we just finished with Mr. Kapil Singhal. Now I invite Mr. Satish Kumar ji. He's from Tamil Nadu.
Yes.
And he was diagnosed in 2004 based on MRC and ultrasound in Isabel Hospital, Chennai, and Frenchley Hospital, UK. And he had about 8 emergency attack and 4 hospitalization before coming to Ayurveda in 2015. So he was treated for 1 year. Now from 2016 he is disease free and medicine free. Now I hand over to Mr. Satish and
Yeah, thanks Vaidyaji. As Vaidyaji said, I was diagnosed with first attack in 2004 September. So after that, I was getting frequently, like on an average, 2 attacks per year. So when I was browsing through a permanent cure for pancreatitis, I came to know about Padao. So I got a chance to meet Vaidyaji in Bangalore. So he instilled the confidence in me that it can be cured. So I came to Padao in 2015 September, and 1 month to 3 weeks I stayed there. After that, completed 1 year medicine. Now I am totally attack free. I almost forgot that I have pancreatitis once upon a time. So now no further attacks in the past 5 years. So I am feeling relieved. So that is my story. So last 5 years has been very good for me. No more further attacks. After I took the treatment, my attacks stopped. So I didn't get any attacks. Sometimes I feel the uneasiness that is manageable when compared to the huge pain I used to suffer before the treatment.
Thank you, Satish ji. Dr. Tandon ji and Dr. Singhal sir, house is open for you.
He's a lucky man. He's a lucky man to get you.
Yes, sir. Had I known in 2004 only, had I known him in 2004 only, I would directly come to, so that I may not have suffered for 10 years.
Yes. Those sufferings would have been vanished. Anyway,
yeah.
It's a time. Yeah. But don't leave him now.
Yes.
Sir,
whatever the instruction he has given, that is good for everyone, not only pancreatitis patient. If you follow his instruction, no one will get any disease. The food which we take and balanced diet, all those things. Even my family members started following that kind of.
Right, you are.
Okay. Dr. Singhal, do you have any question for him? Hello? Unmute karna. डॉक्टर सिंगल, आर यू हियरिंग मी? आप अपने फोन को अनम्यूट कर लीजिए.
Yes, I can hear you.
हाँ, तो any question for him?
Question to
Mr.
Dr. Tandon.
Satish.
And he has already said that he has been following the diet control and medication, so he's keeping fine.
Good.
So there's hardly any question to be asked from him. So far as disease is concerned.
So I introduce the another guy who is a doctor himself. He's an MBBS doctor from Telangana, and he was diagnosed with acute or chronic pancreatitis in August 2011 based on MRCP, CT scan, blood test, and he had been to KIMS Hospital and AIG, which is very famous for the treatment of pancreatitis. And he had 20 attacks, for which he has been admitted 6 times, and rest of the thing he managed by himself being a doctor. And he came to us in May 2019, and one thing more, that he had an elevated CA19.9 level, which was a marker for showing progression of pancreatitis into pancreatic cancer. So I invite Mr. Dr. Sudhir Kumar to give a brief narration about his experiences and well-being.
Good evening, doctors.
आप अपने को
Hello.
unmute
Yes,
करो.
yes,
Sir,
yes, yes.
my audio is audible? Yes. Sir, myself, Dr. Sudhir Kumar, as sir told me, I was diagnosed with pancreatitis, acute pancreatitis in 2011 when I was undergoing my UG. So at that time, the pain was not much severe, but as this pancreatitis is a progressive disease, within a year it was getting severe and severe. I had to get myself admitted in the hospital, in my same hospital, for in a month of 6 months gap. So they have they have questioned, all the senior doctors have questioned me, what you take alcohol or smoking or anything like that. But I was not on any addiction. But still, I got this disease. When I visited AIG, Asian Institute of Gastroenterology in Hyderabad, under the treatment of Dr. Nageshwar Reddy, he has diagnosed my disease with a reason of autoimmune pancreatitis. So the treatment which he gave me was steroid and all normal crayons and painkillers, everything. But I was not satisfied with his treatment. Within a year, I used to get a severe attack, which I used to get myself admitted in the hospital again, nearby hospital. So searching about Padau, one day I came to know about Vaidya, and I just decided myself. I told my parents that I want to go here and get myself treated. Let's see, because they didn't believe in Ayurvedic treatment, I have to convince my parents a lot. And my father, still being a businessman, he came with me to the Padau in May 2019, last year, and I started my treatment. Within a week, I was so much relieved. The first day, sir has stopped all my allopathy medicines, which I was taking from since many years, like pantoprazole and everything, PPI, and that was the reason. That was the main cause for my vitamin D deficiency. So that was also cured after stopping PPI, and I was getting very much relief from the Ayurvedic treatment. And plus medicines, along with medicines, the diet was also very helpful. Uh, mm, Whatever the diet we used to get in Padau, uh, that's beyond, we have left those diets. Nowadays, we don't follow all those things. Getting early to sleep and early to rise, we have forgotten everything. So in Padau, I got to learn again that following a timetable, following a proper diet is very important. So now it's almost now 1 year now. In between, I used to get a stomach discomfort and all, but that was manageable. I was always in touch with Parao whenever I used to have any problem, and they used to guide me. And I'm sitting with you, sir.
Thank you, Dr. Sudhir, for. And
That's my story.
And how's your tumor markers now?
Sir, it has been reduced, sir.
Very good.
37.
Very good, excellent. You are on the border. So, Dr. Tandonji is a case which goes into progression from pancreatitis to pancreatic cancer, especially autoimmune pancreatitis has a poor prognosis. So now he's to you for questions and Dr. Singhal sir.
And nothing to ask. He is lucky that he is in a reversible stage.
Yes, sir.
And one more thing that
He is lucky. You are lucky.
we start giving them fat from the day one. They eat malai, they eat paneer, they eat doodh, dahi, everything during this Ayurvedic treatment. So, Dr. Singhal, do you have any question for this? Doctor?
नहीं, क्वेश्चन वाली बात नहीं है, खाली पेशेंट के लिए कमेंट है कि इतना सब इम्प्रूवमेंट हुआ है तो वैद्य के पास ही ट्रीटमेंट फॉलो करो और सारा डाइट का शेड्यूल जो उन्होंने बताया हुआ वो सब फॉलो करो तो शायद जिंदगी अच्छी चलेगी.
Okay, thank you, sir.
नहीं सर, जिंदगी बहुत अच्छी चल रही है.
That's good.
I welcome
Thank you, sir.
Mrs. Pramila Agnihotri ji, whom I am seeing after a long time through this screen. She is the mother of a boy. His son is Sagar Agnihotri. He was 28 years, and when he was diagnosed for chronic calcific pancreatitis in July 2009, based on MRCP, CT scan, ultrasound at QRG Hospital, Noble Hospital and Fortis Hospital, Faridabad. And he had 5 emergency attack and 5 hospitalization during this period. And they came to us in 2015, took for 1 year. So she's here, Pramila ji. Pramila ji, can you hear me? Pramila ji, can you hear me?
Yes, I can. Namaskar. My regards to all the doctors to thank. Yes, I can hear.
Okay, yes, carry on.
Namaskar. My regards to all the doctors and dignitaries on the panel. And I have no words to thank Veggie for giving life to our family through the treatment of pancreatitis to my son. He was 17 years old when he had pancreatitis. We are pure vegetarians, non-alcoholic. For 7 years, he had 5 attacks, and 5 times in 2015, the doctors told me that a stent has to be inserted in his pancreas. I had been to all the major hospitals in Gurgaon and Delhi. And from there, I was so upset that I somehow searched on the net and I found, to my good fortune, Veggie. We contacted them and immediately he called us and we went to Dehradun. There we stayed for 21 days and 1 year of complete medicines and diet restrictions, whatever he told. And today my son is free from this disease and we have no words to thank him. Our life has really changed. We were in great depression. He's our only son, and we were suffering like anything. And now, as one of the patients said that he doesn't remember that he had pancreatitis, same is with us. And very soon, my son these days in the lockdown is again and again asking me that he wants to go and stay with Veggie and spend some time and show him. And what should I say? वो बोल रहा था कि क्या मैं एक recharge करा लूँ अपना? So we were about to call him and come and visit his place.
Okay, thank you, Pramila ji. You have gained weight in lockdown period.
Actually, I'm going through hormonal changes, so all swelling on my face only.
Okay. So we have 5 people from different part today to share their experiences with the learned doctors. Dr. Tandon, as I said, he's a very senior surgeon and he has seen thousands cases of different surgeries and everything. So he's a synonym of Bareilly. If anybody come from Bareilly, so say, do you know Dr. Sushil Tandon? And if somebody says Dr. Sushil Tandon, that means Bareilly. So today we are lucky that he's here to listen to your experiences, and his blessings are with me always, and that blessing I pass to you. So the healing I got, these are the doctors behind me, Dr. Sushil Tandanji and Dr. Giri Singalji, whom I adore a lot because in any crisis of any medical emergency, many patients have it. So I always contact them and they guide me. So now I will request Dr. Tandon to say a few words as today's panelist.
Vaidji, I must congratulate you that for such a chronic disease where we are not able to give relief to the patients, and you are doing so wonderful. God bless you. Please go ahead and make a name in the field of pancreatitis. The others, you are also doing it, but pancreatitis is such a disease which kills the patient for no reason, for no reason. So, hats off to you. God bless you.
Thank you. And I will introduce you Dr. G.C. Singalji, who has done his MD, MBBS from Meerut Medical College, and then he had been practicing he's a senior cardiologist at Agression Hospital and associated with many hospitals in Delhi. And besides, he runs his own clinic, single heart care at Pashchim Vihar, Delhi. He had been a pillar to me in medical field, where I have any time 24 hours I can seek his advice in any emergencies, patient suffering with any ailment while I am treating patients. And he was my co-PI in the project which I got from Government of India, acute promyelocytic leukemia, where we could save 11 patients out of 11 after 90 days of treatment. So his presence always motivates me, encourages me, like Dr. Tandon's presence.
Thank you very much for kind introduction.
So please say a few words to the people today.
आपका बहुत बहुत धन्यवाद है मेरी इतनी तारीफ और मेरे बारे में इतना डिटेल में बताने के लिए। और आपके पेशेंट्स पैनक्रेटाइटिस के तो मैंने सुना ही है, उसके अलावा वैद्य जी के साथ मेरी क्लिनिक के थ्रू ही एक माइग्रेन के ऊपर एक साल 3 महीने की एक स्टडी की थी, जिसमें आयुर्वेदिक ट्रीटमेंट ही दिया गया था और करीब 90% पेशेंट्स में सक्सेस रेट रहा है। और जिन पेशेंट्स ने अभी तक वो डाइट प्रॉपर फॉलो करी है, उनको माइग्रेन का अटैक दोबारा नहीं आया। जो पेशेंट्स डाइट में इरेगुलरिटी करते हैं, उसमें थोड़ी बहुत दिक्कत आ जाती है, वो भी उतनी नहीं होती, काफ़ी हल्की होती है। बाकी पैनक्रेटाइटिस के बारे में तो आप लोगों ने सब डिफरेंट पेशेंट से सुना ही है। और भी कुछ प्रॉब्लम्स हैं जो वैद्य जी डील करते हैं और जो सक्सेसफुली डील कर सकते हैं उसी को ही टेकअप करते हैं। ये सबसे इम्पोर्टेंट बात है। बस मैं फिलहाल इतना ही कहना चाहता हूँ।
थैंक यू डॉक्टर साहब। आपके दर्शन आज हुए वो लॉकडाउन पीरियड में, अब नहीं तो साल 6 महीने में आपसे मुलाकात होती रहती है। तो टुडे वी हैव वन मोर special invitee who was very keen to come, though he is not a doctor nor is a pancreatitis patient. He is a pilot, and this is Mr. Sanjeev Singhal is there. He was a senior pilot in Jet Airways, but I treated him one sort of malignancy. He was very keen because he keeps on following me for our scientific endeavor, and not only scientific endeavor. Last year when I had a dharna for making sadak in this area, he came all the way from Faridabad to support this venture. So today Sanjeev Singhal ji is here, and I welcome you, Mr. Sanjeev Singhal ji. So you had.
Thank you, doctor.
So please, you are again a panelist, not as a doctor, not as a pancreatitis patient, but you are here at your own, like a pilot. You drive. So house is open for you.
Thank you, Vaidya. It's always a pleasure to be able to participate in any of the wonderful endeavors which you undertake. Like Vaidya told me that in 2012, like very many people, I had not much of knowledge about Ayurveda, or nor did I know Vaidya. And when I was detected with a a problem of CLL. I went to various hospitals and like PGI Chandigarh. I went to uh, one hospital in Mumbai to the hematologist, oncology, hematology, and everybody told me that this particular ailment will gradually progress. We can do nothing about it. And when it reaches a certain level, only then we will start your traditional chemotherapy and radiation probably. And I was wondering why, when it's in the such nasal stage, why can't it be cured? Anyway, I, like all the other people, somehow were fortunate that we came across Veggies' name on the, thanks to the internet. And I I spoke to him, and then we came to Padao in 2012. And I was there with him for only about 2 weeks because I was actively flying those days and didn't get too much of leave. And after that, even within the next 5-6 days itself, I started seeing a remarkable change in my condition, in my counts, and what the neutrophils rising and your lymphocytes reducing, it started happening, which gave me a lot of encouragement and faith. And slowly with his magical way of lifestyle and diet, I started improving, and slowly all my parameters came back to normal. Yes, I was under the same dietary restrictions and medication for about 2.5 years, with tapering off of medicine, tapering off of diet, in the sense that I was given more leeway. The strictness of the diet was reduced by veggie gradually, and the medicines started tapering. But my lifestyle changed for the better, and ever since then, my medicines stopped in 2014 mid, and ever since then I've not been on medication. I've just been following the diet and my lifestyle as given by Veggie. And like all his fans and patients, I'm in regular touch with him. And I thank him immensely for the wonderful longevity and life he's given to me. Thank you, Veggie.
Thank you very much. So I once again thank you, Dr. Sushil Tandonji, Dr. Girish Singalji, and all my dear son, because there is a relation between physician and patient, like father and son. So whenever I see smiling faces and who are fear-free from the disease, so it is always a pleasure and very satisfying moment. And nowadays it is a COVID era, and I would like to share that I have treated 18 patients out of 18. And one of the medicine you have all taken, this is called Prac20 or sneeze cure. So it is immunomodulation, and the patient who have taken pancreatitis medicine, their immune system is much stronger than others, but still keep safe. And if you have any chance, just let me know. Don't be scared, be fear free for anything, and God bless you. Nice meeting you. With this, we call off this webinar this evening. See you again. Namaskar.
Thank you so much, sir.
Namaskar.
Thank you.
Ji.